He was taken from us. Yes, of course, too soon. But we are the ones left with holes in our hearts, missing how big hers was.
A Florida teacher writing her own obituary there as she gets ready to head back to school. Whitney Reddick says she doesn't think schools are well enough equipped to keep students and teachers safe from the coronavirus pandemic, adding that she would prefer for classes to resume virtually. Despite this, she says she will return to her classroom on August 20th, but she's extremely worried for her safety.
I love my job. I love my job so much. I teach children with severe special needs. What if I go on a ventilator? What if my husband gets sick and then we're both in there? Who takes care of our son? What if I pass away? What if he passes away?
Florida has seen a surge of coronavirus cases over the last few weeks. Duval County specifically has said they are working to provide more testing for school teachers while also proposing to cover some of their medical costs. Turns out not all Americans are using cleaning products correctly. That's according to the Centers of Disease Control and Prevention. Nearly 40% of adults reported using disinfectants in a way experts deemed potentially dangerous. Of the roughly 500 adults who took the survey, about 19% said they've used bleach to clean produce, and 18% have used household cleaning products on their skin. Speaking of cleaning product no-nos, the CDC is reminding Americans not to drink hand sanitizer. The agency says 15 people were recently hospitalized after drinking it. 4 died, 6 had seizures, and 3 had vision loss. Anyone who does ingest sanitizer should seek immediate medical help. The race continues globally to create a vaccine for the coronavirus. But once the vaccine is approved, who will be the first to receive it? Fox's Danielle Lama reports.
There are multiple candidate vaccines that are moving along at a very rapid pace.
As the U.S. gets closer to approving a COVID-19 vaccine, a new debate is igniting. Who will have priority access?
I think it's unlikely that the COVID-19 vaccine that first hits the market will be made available as a first come, first serve type of vaccine.
The Advisory Committee on Immunization Practices, which is part of the CDC, met in late June. During that meeting, presenters suggested the vaccine first go to healthcare and other essential workers and high-risk populations. Those plans still being discussed and tweaked.
There obviously are a lot of populations that could benefit from being able to prevent COVID-19.
Dr. David Aronoff, an infectious disease expert at Vanderbilt University Medical Center, says the current trials are focused on adults. More research may be needed to target other populations like kids, those severely immunocompromised, and pregnant women.
This large trial that we're participating in now is not including pregnant people in the trial. And so whether the vaccine can be used in that group is not going to be clear from this trial.
While a vaccine may be close, the new race will be to how to distribute it as quickly and effectively as possible.
It will take us 4 or 5 months to get people vaccinated to a level that you can say, okay, now we are getting immunity to a level that we can start relaxing those protective measures.